All right, everybody. I'm here with Dr. Angie Weber, and she has her doctorate in both Chinese medicine and acupuncture. She is incredible. I have attached her information below for you guys. She owns her own business, Acuhaus, and it's right down the road from us. So all of that information will be below so you guys can access her. But we are here to talk about postpartum and acupuncture and the benefits of it. So I'm going to start and have you tell us a little bit about you, and then we'll get rocking.
Hi, like she said, I'm Dr. Angie. I have been an acupuncturist for 2 years now. And like she said, I own my own business also. And prior to this, I was actually a personal trainer, laboratory technician, EMT. So I have a lot of Western medicine background. So for me, combining the East with the West is perfect. So working with like Chiro For Moms is so great because I know what they're talking about when they tell me about certain muscles being out of balance with the patient. So it's really nice to have that background to pull it all together.
Awesome. Yeah, no, we love collaborating with you. It's so much fun.
Totally is.
All right. So in terms of postpartum care, we have a couple things that our women just ask us about, and it's just, you're the expert. I want you to kind of touch on it. How can acupuncture really help with, like, the big one I think we talk about is headaches and depression, honestly.
Mm-hmm. So those are huge for postpartum. So when we're talking about headaches after you've had a baby, you know, you've just lost a lot of chi, which is like your energy, like how your body is feeling. And, you know, when you're hitting towards that end, you get that kind of nesting symptoms, you know, you're like wanting to go, go, go. And that's kind of that chi is so big right now. You have this baby growing, you have so much going on. And then after you have it and you go through labor or maybe you have an induced and you have surgery, it's really taxing on all of your systems. And so it's very common for women to have depression, fatigue, just generalized pain in general, and headaches. So some of the things we do are helping to just regulate your body and build you back up. So for us, it's acupuncture. It's also using some herbal therapies to really work internally so that you can feel your best, have energy again, be able to produce milk if you're breastfeeding. That's one of the big things too. New moms really worry about how much they're producing. And so there's acupuncture points and phenomenal herbs to address that issue too, when we're looking at all the different postpartum things. And
I didn't know that. That's really cool about the breast milk.
Yeah. So yeah, there's actually a point you can stimulate for supplementing your milk. And it's actually right by your pinky, right by the pinky nail. And just stimulating that can help with the letdown reflex, and it can also help with production. So that's kind of a fun one.
Incredible. I know a ton of our women in our office, and I think that they think that maybe they're doing something wrong. We hear about postpartum depression, but it's like, why am I like this? You know, what's going on and what's wrong with me? And it's just, your body's going through a lot. So wonderful. Exactly. And then how about like stress and anxiety?
Definitely. So stress and anxiety, that's a given, right? You've got a new baby, you know, maybe this is your first, maybe this is your multiple, and now you've got all these extra things in your life and you're not sleeping, and you're probably really not going to be able to sleep. Like that's just a given. Like you're going to be up every few hours and have that broken sleep pattern. What we can do is really help calm the nervous system with the use of the acupuncture points, be it through acupressure. So sometimes just pressing on the points. Sometimes I use a tuning fork, and a lot of times I use needles. But we have different therapies we can use. Some people really like, I have some really fun ear seeds that go in the ear, and they're little crystals. Yeah, and so it doesn't always have to be needles to get you the effect that you're looking for of calming the system. It doesn't fix your sleep pattern because you've most likely got a newborn baby, but it can help how your body's responding to that lack of sleep.
I think that's really important for women to know too. It's not, you know, if you're a big needle wigged out by needles, like there are other alternatives in the way that this therapy can still help you and help provide you relief. Because I don't like needles either, but I will tell you it was fine with me. I was very impressed.
Oh, good, good.
Awesome. Okay, and then going back into sleep too, how about like staying asleep? Is that something that you can, is there points for helping with just kind of getting more into like you're back into your rhythm a little bit, like baby aside?
Yes. So baby aside, if you find some people have difficulties falling asleep and some people have difficulties staying asleep. So depending on which one it is, I do have different acupuncture points that we work on with that. you know, a lot of them are on your feet actually, which is kind of surprising to people. And it depends on kind of the system. Like if you're a really worn down person but you're still struggling to fall asleep, there's different points I can use on your feet to regulate that system to give you more energy, but it's so that you're more tired, if that makes sense. It's balancing that energy. And if you're kind of like super wound up and you're thinking and you're like, oh my gosh, the baby, and you're worried and you just can't stop processing, I have some points that are on like the inside of the ankle that are really nice for helping calm that kind of busy mind to where you can't sleep. Then there's the things like restless leg, which is so common after birth, which is, it's maddening that your leg keeps wanting to twitch and you can't fall asleep. There's beautiful points to calm that as well. Or if you're the person that like you fall asleep and then 2 hours later you're up and you're like, oh my God, I need to sleep. The baby's going to be up in an hour. You know, why am I not sleeping? We have points that will help to calm the system. One of the points that's used for all of those cases is actually right on the top of your head. So kind of where your head goes up and meets like the very top point here. So you can see how it's coming down right here is a nice point. And you can rub that for like 30 seconds to a minute. Some people, if you need more energy, you can actually give that a little bit of pounding and it helps to like, wake you right up. And that's like if you're feeling tired and you need to be awake, but for sleeping, you really want to just press it and do a nice little circular motion with your finger on it.
So would that be good, like kind of right before bed?
That'd be before bed. That would be great. If you happen to be the person that's trying to take a nap while the baby's resting, which we all recommend, almost no mom does it because they're like, I gotta do laundry, I gotta clean the bottles, or, you know, all these different things. You know, giving that a little bit of attention throughout the day is a nice way to calm the system.
Amazing. The other thing, and we're getting into this right now, just being in January in Minnesota, ear and sinus issues and with congestion and kind of, you know, those cold and flu type symptoms, COVID aside.
Yes.
How about what do you have for ear and sinus?
Sure, definitely. So when we're talking about sinus congestion, a lot of times you have some sort of phlegm, right? You've got mucus in there, it's building up. Some of the wonderful points are right next to your eyes. So rubbing these like at the end of your eyebrow here, and then like halfway over your eyebrow, and then at the very end. So kind of giving this some nice little attention, and then more attention and more.
And would you then points too?
I would normally needle those, yep. And then you can also come up to where your hairline naturally starts to turn down. There's another wonderful acupuncture point there that really helps to open the sinuses. So really, you kind of can't go wrong. Any pressure throughout the forehead, especially if you find someplace that's tender, the tender areas, you want to spend some extra time. The last one I love is actually right next to the nose. So you come in here, and even just pushing that and holding it, oftentimes people can feel the sinuses clear, and you'll start having drainage. Your nose will start running, or you'll get it going down the back of your throat as it's clearing. So that's for this kind of area of sinuses. Now, when we're talking about the ears, there's some points that are right next to the little bump here on your ear, just on the inside of it. So if you see here, if I open my jaw, there's a divot. So,
oh yeah.
Yep, so you get in the divot. And I know, exactly. And that's your acupuncture points for the ear. So these are good for clogged ears. They're great for kids. If they're having an earache, you can press on these. And then also ringing in the ears. So it's kind of a really nice ear point in general. The other one for the ear is going to be below the earlobe, just behind the jawbone. So kind of coming together right in here. A lot of times it's really tender. A lot of muscles connect right in here. So you can give that some extra attention to get your ears to open and drain. And also, I usually recommend for people to go see their chiropractor because I know you guys have some techniques for, you know, opening that up and kind of opening that clogged feeling too. So that's often what I tell my patients is, you know, I'll come in for these acupuncture points, but please go see your chiropractor because often there's something off in the neck too. Like I feel like they need an adjustment in there.
Oh, that's awesome. And exactly. And that's why it works so well in tandem with each other, because we can address the structural and the biomechanical aspect, and you can adjust the ears too. If you guys have been to our office and you've adjusted your ears, it's really easy.
Yeah.
And put it on your little ones at home too. All right. Well,
Yeah.
Dr. Angie, thank you so much. I think that's all the time we have, but it was so great talking to you and getting your expertise.